Welcome everybody. Good evening. Welcome to the class. This is biochemistry. One question I will be discussing, which is vitamin question, right? So it's a very important question. You see the question. The question is talking to you about neonatal seizure, which is associated with vitamin deficiency. And it's very much repeated question. So you must know it is vitamin B6 deficiency, which number of times results in epileptic fits in newborn. Right, so vitamin B6 pyridoxine deficiency results in neonatal seizure. And the reason for this is the glutamate, which is excitatory neurotransmitter, is converted to GABA, gamma amino butyric acid, which is inhibitory neurotransmitter. This is via decarboxylation for which vitamin B6 is required. So you must know that glutamate is excitatory neurotransmitter and GABA is inhibitory neurotransmitter. And for converting glutamate to GABA, you need to have vitamin B6, right? So in babies having vitamin B6 deficiency, what is going to be there? The glutamate level is going to be high. The excitatory neurotransmitter will be high. The inhibitory neurotransmitter will be low. So that will result in firing of neurons and epileptic fits. So that is how you must know this. And vitamin B6 is something very important. It has got multiple roles to play for transamination of various amino acid transaminase enzyme. You need to have vitamin B6, right? So, and that too in PLP form, that is pyridoxal phosphate form. Then decarboxylation of not only glutamate, various other amino acids like histidine, 5-hydroxytryptophan, cysteine, and serine. Their decarboxylation also require respective decarboxylase enzyme for which you need to have vitamin B6, right? Okay, so glutamate to GABA formation, histidine to histamine formation, 5-hydroxytryptophan to serotonin formation. Serotonin is 5-hydroxytryptamine. Cysteine decarboxylation is resulting you in taurine formation. Serine decarboxylation, ethanolamine formation. This you need to remember because this itself may be a direct question to you that taurine is derived from which amino acid. You have to say cysteine. Ethanolamine and serine, what is the difference? The decarboxylation, right? So these things you must know. Then when we talk about sulfur containing amino acid metabolism, there are two important enzymes in sulfur containing amino acid metabolism. One is cystathione beta synthase, another is cystathionase, and both of them they need vitamin B6 in PLP form. So in B6 deficiency, again this metabolism will not be adequate and person may have manifestation of homocystinuria because cystathione beta synthase is going to utilize the homocysteine. During formation of cysteine, homocysteine is utilized with the help of this enzyme. So if this enzyme is not acting due to deficiency of vitamin B6, homocysteine will be high, resulting in homocystinuria kind of manifestation. Similarly, cystathionase deficiency. When PLP is deficient, B6 is deficient, cystathionase will not act. So that will result in cystathionuria. Cystathionuria. Then when we talk about heme synthesis, the rate limiting enzyme ALA synthase needs vitamin B6. So in deficiency of B6, person will have microcytic hypochromic anemia as well. Kinuraninase enzyme, which is needed for NAD formation from tryptophan, that also needs vitamin B6 in PLP form. So in B6 deficiency, NAD is not formed. That will result in B6 pellagra. B6 pellagra. Glycogen phosphorylase is going to utilize maximum amount of vitamin B6. In fact, they say 60% of body requirement of vitamin B6 is because of this glycogen phosphorylase utilization, right? So this is how the role of vitamin B6 you must know. And some more interesting fact regarding B6 is that it's called rat antidermatitis factor. It's a very old name for vitamin B6. Source is nothing very specific, but yeast, seed, green, egg yolk, royal jelly, they are good source of vitamin B6. And the RDA recommended daily allowance is going to be 1.5 milligram per day. right? So this is how you need to learn this vitamin B6. And I can give you this link also. If you want to know little more about vitamin B6, you can go to the PubMed article, which is talking to you about this particular condition where vitamin B6 deficiency results in epileptic fits in newborn. Thank you very much. Wish you all the best.